Post-surgery swelling can be unsettling. It often appears suddenly, changes from day to day, and does not always match how you feel otherwise. One day the swelling looks worse. Another day it seems to settle. Sometimes it increases even when pain feels manageable. That unpredictability leads many people to wonder if something is wrong. The most important thing to know is this: swelling after surgery is expected, and in most cases it reflects healing, not harm. Understanding what swelling does and does not mean can take a lot of stress out of recovery. Many people assume swelling is a sign that something is going wrong. They associate swelling with injury, damage, or failure. So when swelling increases after surgery, it can feel alarming, even if other things seem stable. But swelling is not just a reaction to injury. It is also a key part of how the body heals. After surgery, the body sends fluid, immune cells, and healing signals to the area. That process increases circulation and brings resources where they are needed. The result is swelling. In that sense, swelling is not the enemy. It is part of the body doing its job. What makes swelling confusing is that it does not follow a straight timeline. It can increase before it improves. It can fluctuate from day to day. It can look worse after activity and better after rest. That does not mean recovery is stalling. It means the body is responding to use, gravity, and inflammation. One important thing to understand is that swelling often peaks later than people expect. Pain may be most noticeable early, but swelling can build over several days. This is especially true once activity increases. As you begin moving more, sitting upright longer, or resuming daily tasks, fluid tends to accumulate. That accumulation is influenced by gravity and circulation, not by damage. So swelling that increases after movement does not automatically mean you have done too much. It usually means the tissues are still sensitive and adjusting. Swelling also tends to change throughout the day. Many people notice that swelling is minimal in the morning and worse by evening. That pattern is common. Fluid builds as the day goes on and often redistributes when you rest. Seeing this pattern can help prevent overinterpreting a single moment. Swelling does not usually mean that something has shifted, torn, or failed. It does not usually mean that healing has stopped. And it does not usually mean that you are behind. Those assumptions are understandable, but they are often incorrect. What swelling does mean, in most cases, is that healing is active and ongoing. That said, not all swelling is the same. Normal post-surgical swelling tends to have certain characteristics. It often feels tight or full rather than sharp. It may feel warm, but not intensely hot. It usually changes with position, activity, and time. It often improves with rest, elevation, or simple supportive measures. Importantly, it tends to fluctuate rather than steadily worsen without pause. Swelling that follows these patterns is usually part of the expected recovery process. What swelling does not usually mean is infection or structural damage on its own. Those conditions tend to come with other signs. Swelling that deserves closer attention is swelling that is rapidly worsening, unusually painful, or associated with other symptoms. Examples include fever, spreading redness, increasing drainage, or pain that is escalating rather than fluctuating. Swelling by itself, especially when it comes and goes, is rarely the only indicator of a serious problem. Another common misunderstanding is the idea that swelling should steadily decrease every day. That expectation sets people up for unnecessary worry. Recovery is not a straight descent from swollen to normal. It is more like a series of rises and falls that gradually trend downward. Progress is measured over weeks, not hours. Swelling can also affect how the area feels, even when healing is on track. It can create stiffness, it can limit range of motion, It can make tissues feel heavy or resistant. These sensations can make it feel like you are not improving, even when you are. That mismatch between how things look and how healing is actually progressing is one of the hardest parts of recovery. It is also why swelling often causes more anxiety than pain. Pain tends to improve in a way people can recognize. Swelling is less predictable. Understanding that unpredictability can prevent over-monitoring and frustration. It is also important to understand that swelling does not respond instantly to what you do. What you see today may reflect activity from yesterday. What you feel tonight may reflect what happened earlier in the day. This delayed response can make cause and effect feel unclear. People often try to link swelling to a single action. In reality, it is usually the cumulative effect of time, movement, and healing. That perspective can help you avoid blaming yourself for normal changes. One of the most helpful ways to think about swelling is as a signal, not a verdict. It tells you that tissues are active and sensitive. It does not tell you that you have failed or caused damage. When swelling is present, the goal is usually not to eliminate it completely. The goal is to manage it while healing continues. That means balancing movement and rest, rather than choosing one or the other. It also means recognizing that swelling often improves gradually, not suddenly. For most people, swelling decreases in stages. There may be periods where it seems stubborn. Then, over time, it becomes less intense, less frequent, and less limiting. That progression is more important than day-to-day variation. If you find yourself watching swelling closely, it can help to zoom out. Ask yourself how things compare to a week ago, not to yesterday. Ask whether movement is becoming a little easier, even if swelling is still present. Those broader trends are more meaningful than individual fluctuations. Swelling can feel discouraging because it is visible. It is something you can see and feel. But visibility does not equal danger. In most cases, it simply reflects where the body is in the healing process. If you are experiencing swelling after surgery, you are not doing something wrong by noticing it. But you do not need to interpret it as a setback. For most people, swelling is a temporary part of recovery that gradually settles as tissues heal and adapt. The goal is not to rush that process, but to understand it. Clarity reduces anxiety. And understanding what swelling does and does not mean can make recovery feel far more manageable.